Welcome back to After Surgery. What the
Could have been 30, could have been a G. Should've never snitched. Why you take it to police? Now they're looking at you funny when you're walking down the street, looking at you like food, trying to see what they can eat. Me, I'm like Wallow and Gilly with the game. You don't really want to act silly, behave. When I was on stage and the million gets made.
Today we're talking about something super common in the aesthetic industry. For any of you patients who've had any injectables or fillers, but why do things look worse after surgery or after a procedure before they look better? Let's get into it. We'll start out with what patients are seeing after surgery. And again, I've kind of touched on a couple of these topics in previous videos, but it's super important to sort of delve into some of the psychological aspect of cosmetic surgery because there's a lot that goes on. For example, early after surgery, patients often notice the bruising, the swelling, the scars are super visible, and believe it or not, they actually will look worse in the coming weeks before they start looking better. But this is all a process of healing. It's all a process of controlled trauma, and so you can't be too quick to judge your results. Results can look distorted, super unfamiliar, and they may not even be exactly what you're looking for. But remember, as plastic surgeons, we're trying to hit a moving target. Your skin's going to stretch, things are going to fluff out. We want to get you to your desired results, but as surgeons, we should be able to predict some of those steps, what it's going to take for you to get there. So what you see is not necessarily what you're going to get. So let's talk about what's actually happening under the surface of the skin. Again, surgery triggers inflammation, and inflammation is a part of healing. This is a normal part of the process. It's actually something you want to take place. So the inflammation causes fluid buildup, tissue swell, bruising appears. This is all normal. These are all normal changes of the contour. You know, sometimes it's important to tease apart a normal part of inflammation versus a complication after surgery. And that's where your plastic surgeon comes in. That's where your follow-ups are super important. Remember that healing is inflammatory. It will be inflammatory before it necessarily is aesthetic, if that makes any sense. So why does it often peak before it improves? Now, if you're one of my patients, you know exactly what I tell you. And I tell all patients this right after surgery. Remember, that third week is what's called the peak inflammatory response. So that's typically when patients will be the most swollen, the most sore, and the scars are actually going to look the ugliest. And the reason for that is that's usually around the time in most patients where you get the highest numbers of those inflammatory cells as part of healing. So those neutrophils, the lymphocytes, all the inflammatory markers are at the incision site, at the surgical site. And that's what typically will make it look a little bit uglier than normal. But the skin should have closed by then, ideally. That's what I tell my patients. This is the time to start the scar cream. It's all about timing. Bruising can exaggerate some of the shape, some of the firmness, of course. Gravity can pull some of that fluid into areas that you don't necessarily want it to be. These are all common, issues that we see early on in the post-op recovery process. And let's also touch base a little bit about the role of compression because it's super important and it's part of that process to help expedite your healing process to get you quicker to those results, and it's a combination of the garments themselves, depending on what operation you had. If you had a breast augmentation or a breast lift, support or a bra is super important to help lessen some of that inflammation. If you had liposuction or tummy tuck, lymphatic massages are absolutely key. You want to make sure that whoever your lymphatic masseuse is really working the tissue, milking that liposuction fluid out into your lymph nodes, which you actually may feel in your armpits or even in your groins, little kidney bean shapes that are swollen. That's how you know you're getting a really good massage, because that fluid is making its way out of your system into the lymphatic system so that you can pee it out and get rid of that extra fluid. And compression supports healing, not your final shape. You shouldn't have to rely on compression to get you your final results, but it's supporting you on your way there. So why is healing not necessarily linear, right? So why don't you see a stepwise approach? And that's very common. It's because everybody's different. The lymphatic system's different. Everyone swells differently, and it really depends even on what operation you have. So healing doesn't necessarily follow a straight line. Day-to-day changes are normal. Believe it or not, it does take about a year to see your final results, but most of that swelling, most of those results you should start seeing pretty quickly, between 3 and 4 weeks. After 6 weeks, that's the acute phase of healing, you'll definitely start seeing noticeable results. And then a lot of patients can remain swollen 3 to 6 months out. So it really depends on you, depends on what you had done, how much you had done. But healing is never linear. Daily changes don't necessarily equal the final results. You just kind of got to be patient with it. Trust your plastic surgeon, and obviously go to all of your follow-ups. So as a patient, then you're probably asking yourself, well, how do I know if what I'm looking at is normal or not? How do I know when I'm supposed to reach out to my plastic surgeon? And patients should always reach out to their plastic surgeon if they feel that there's something wrong, especially early on in the post-op process. If things look way too asymmetrical, if your bruising is getting worse, not better, if you're starting to get fevers or other signs that not necessarily normal in that post-op period, it's super important to follow up with your plastic surgeon. And that's why, I tell all my patients they're stuck with me after surgery, especially those first 6 weeks. They're gonna see a lot of me, and me personally, because I know what I did. I know exactly how things are supposed to go and where the swelling is supposed to be and where it shouldn't be and how tissues should feel. So I see my patients quite often within 24 hours of surgery, a week out, 3 weeks out, 6 weeks out. And if you have a complication, even if it's a small one, sometimes I'm seeing them on a weekly basis to get them through those first 6 weeks, make sure things heal properly. It's important that this episode, what I'm trying to tell you guys is it's about the normal process of healing, not necessarily ignoring symptoms of a possible complication. So it's very, very important to tease those things apart. And if there's any question in your healing process, that you contact your plastic surgeon so that they can help walk you through what is normal and what's not. So just remember, guys, this phase passes. It does take time. Remember, your inflammation is going to peak before it gets better. Scar cream and scar management is all about timing and being diligent. Even after those first 6 weeks, I tell my patients, if you're out in the sun, you don't want those UV rays hitting those scars and causing hypertrophy or thickened scars. So you got to be using your sunscreen. You got to be using your scar cream religiously at least twice a day, ideally for a year-long process. And then there's even other adjuncts that we can use for scar management, like microneedling, CO2 laser, other things that we can do. But remember, your results are not instant. It's going to take some time for your body to heal. So trust the process, trust your surgeon, and good luck out there.